Welcome. My name is Peter Strong. I'm a professional psychotherapist and I offer online therapy through Skype for the treatment of anxiety disorders, including agoraphobia. So if you're suffering from agoraphobia, then you might be very interested in getting online help for the treatment of your agoraphobia. So being able to talk to a therapist online is very essential if you can't leave your home because of your anxiety and panic attacks. So if you're interested in online therapy for agoraphobia, then I invite you to contact me and ask any questions you have. And if you are ready, we can schedule a Skype therapy session. The approach that I teach during my Skype therapy sessions is called Mindfulness Therapy, and this is a very effective and strategic way of working with agoraphobia. The primary teaching is about how to do very strategic exposure challenges, but preceded by very thorough training in mindfulness to effectively neutralize and deactivate those habitual reactions that cause your anxiety. So the classic way we go about this is I will have you imagine doing that particular challenge, such as walking out onto the street or driving a short distance if you're able to do that. I'll have you imagine doing that, and then we look for any anxiety reactions that get triggered as you play through that scene. When you've identified those anxiety reactions, which are habits, they are habitual reactions, then we start to focus mindfulness on them to break those habits, to overcome those blind habitual reactions. So this is the first part of training, is learning how to make them conscious so that you are no longer trapped into reacting. So we do that by focusing on those anxiety reactions and learning to stay present with them mindfully, but without becoming identified with those reactions and without becoming consumed by the anxiety. So this is the first step, learning to sit with your anxiety without becoming identified or reactive. So that's essential. And then the second part of our training is to learn how to respond to that anxiety in a way that promotes its healing. And the first very important part of mindfulness training is learning to develop compassion towards the emotion itself. The emotion you can think of as being like a child. It is stuck. It doesn't know how to heal its own suffering. It needs the intervention of its parent. Well, your emotions need the intervention of you, the larger, higher self that we call the true self, that is not identified with the anxiety, which we often call the little self. When you can establish that right relationship based on mindfulness, based on objective consciousness, where you can see the emotion as an object, then you're in a position to actually help it change and heal. So the first part of training is learning how to sit with it so we don't feed it through reactivity. The second part of the training is learning to respond with compassion, discovering what will make the emotion feel better. And there's a variety of techniques that I will teach you during our Skype therapy sessions together on exactly how to do that. So that's what you do before you do an exposure challenge. You play through the scene until you have completely neutralized those habitual reactions so now you've broken free from those habitual anxiety reactions. Then you do the challenge, and that will reinforce your new internal perceptions of that particular scene, like walking around the block or going into a shop or driving in your car. Then, after doing a challenge, we might do some more meditation using mindfulness to look at any anxiety that arose during the challenge. And that's very important. So we play through the scene that we've just done, and then we look for those triggers and the anxiety that got triggered. And in the same way, we work on changing our relationship to that anxiety so that we can re-establish objective consciousness, so we can see it the same way that you could see a scene on a movie screen. You can see the scene, but you don't become part of that movie. So you can look at your anxiety without becoming it. That is what we mean by mindfulness and objective consciousness. So we train with that fresh anxiety, if there was any that arose, until it is neutralized. And then you repeat that exposure challenge again. If you approach your recovery process in that way, with this very strategic and very methodical approach, then you'll see rapid improvements. And most of my clients see very dramatic improvements, and within usually a few weeks, once you start practicing the mindfulness-based methods that I'll be teaching you during our sessions together. So if you like the idea of online therapy and you'd like to get help from an online therapist to overcome your agoraphobia, then please reach out to me and let's schedule a Skype therapy session. Thank you.